Public Health Plus was created to explore the interconnectivity of all sectors within the field of public health. This season, we will be exploring communities and the way that data is cornerstone to not only understanding communities, but using this knowledge to activate change. The panel is a continuation from the workshop section of our season offering, Cultivating Data Champions. In this skills-based workshop, participants co-created best practices for being data champions. Today, we continue the discussion revolving our speakers' roles and how they conduct research with communities in a way that promotes partnership, respect, collaboration, and honors their data. Our speakers today are Dr. Natasha DeJarnett, Assistant Professor in the Christina Lee Brown Envirome Institute at the University of Louisville, Division of Environmental Medicine, and Dr. Teri Gartska, Associate Director of the Center for Public Partnerships and Research at the University of Kansas. Our facilitator for this conversation is our own Megan Kennedy, founder of Orange Sparkle Ball.
So I probably know more about the work you're doing. Well, I definitely know more about the work you're doing than either of you know about the work the other is doing. So you're both working with communities in really interesting ways. And so that's why we wanted to get the two of you in a conversation. So if you'll just really quickly introduce yourself and then just talk a little bit, and this might be picking one project or it might be kind of doing an overview, but talk a little bit about how you're working with communities in a way that where data is involved. Natasha, do you want to go first and then Teri, you can go?
Sure, thank you. So I'm Dr. Natasha DeJarnett, and I'm an assistant professor in environmental medicine in the Christina Lee Brown Envirome Institute at University of Louisville. And so for me, the center of my passion for environmental health is justice. And justice in environmental health means that the community must be involved in diagnosing the problems, determining the course of action, informing the health impacts, and meaningfully involved in the activities that can affect their environmental health, and also determining the solution. And to me, this requires meaningful community engagement. But I also have personal experience as well. My grandparents lived in an area of environmental injustice. So this inspires me to uphold environmental justice through meaningfully engaging with communities. So my work is rooted in communities in a few ways. First, I'm one of the co-investigators in the Green Heart Project, and the Green Heart Project is a controlled trial study where trees are the intervention. Actually, trees and shrubs are the intervention. So we're increasing residential greenness, and we're looking at air quality and heart disease risk before and after implementing the tree intervention. So community engagement is foundational in this study. In fact, it was the community that called for trees. So we partner with community-based organizations, groups that serve within the Green Heart study area. And this can include local churches and neighborhood associations, but members of the communities specifically serve in the Community Advisory Board, and they provide direct guidance and participation in study activities. We engage with the community through a newsletter that we have, and then we also have something that we call Green Heart Community Conversations, and that's where our researchers can come and present briefly with the community and have Q&A. So it's larger on the Q&A side and smaller on the presentation side to really have active and engaged dialogue with the community. But we also do things that are somewhat unrelated to tree planting. We hosted a couple art and literature showcases with the community where members of the community submitted their original photos, art, poetry, and for our online showcase, as the last couple of years of COVID has required that we engage online for continued engagement. But I'm also part of, I'm one of the co-investigators in our Superfund Research Center. So there I serve in the Community Engagement Corps, and we facilitate the bidirectional transfer of knowledge between study investigators and the community. So we have a couple teams of community members that serve to advise, respond to, and help inform the research activities. And this includes a community advisory board, as well as a coordinating committee. And we facilitate these opportunities for the bidirectional transfer of knowledge through community knowledge exchange sessions and advisory board and coordinating committee meetings. Thanks for this great question.
Teri, are you okay to take take your part of that? I think there are some themes that are emerging already.
Yeah, I actually wanted to just ask a bunch of questions, Natasha. So I hope we can chat. That sounds amazing. So I am an associate director for the Center for Public Partnerships and Research at the University of Kansas. I'm a social psychologist by training, and I've spent probably the last 15 years at the intersection of state agency work and systems for early childhood and families, and community level implementation and research and data. So I like to do a lot of things, a Jill of all trades, if you will, master of a few, So where I think we intersect is for the last about 6 years, we have been working on with a tool called Iris. It is really a communication building tool, a networking tool, a social networking tool that was designed to build community partnerships around social services in a community. Because we knew that no matter where a child or a family comes into services, whether it's early childhood services or other services, every door should be the right door. And what we had found was really getting community organizations to partner and to coordinate services is challenging. And there are many solutions, of course, it's technologies, but one, the adaptive piece around collaborative problem solving around service coordination, really that was the problem we were trying to solve. And, we weren't software developers, we are, social workers and psychologists. And we knew from the community that the problem that they were trying to solve is we're sending referrals on in an email or on a piece of paper or calling our partners in the community to say, hey, I have this family that has this need. And people, children and families get lost in that kind of uncoordinated, non-formalized structure. And so we're like, okay, let's figure out something to solve that problem. So we worked with communities in near the Kansas City metro, and then down in Southeast Kansas, it's a rural community, about five counties down there. They all collaborate. And we designed Iris to really fill that gap around how do we make sure a child gets the services they need. And part of that is how do the systems that are designed to serve children, families, people, how are they doing things different in order to center children and families? That means they're going to have to come together and solve some of the problems that the community has put forth. So over the last six years, we've supported the development and building of 30 social care networks. So social care networks, the idea around how do we have all of the systems talking, medical, public health, social services, concrete supports, schools, education. When you're thinking about a community, you're thinking holistically. How do we have a network that is, I keep doing this around social fabric, but what is the network that is going to support the people in the community, and how can we help build those networks so that they're strengthened, so that they're not disjointed? And I mean, we know how systems are. They're siloed oftentimes, and they have different agendas and different ways of doing things and so forth. How do we bring that together as social fabric? That's what I've been trying to characterize social care networks as social fabric. And your piece around environmental justice, I mean, that fits right in there. So that's what I have been doing of late. Certainly have lots of data that I'm trying to convey around what it means to have a healthy community and a healthy network of organizations, people serving the needs of the community. So I'll stop there because I actually didn't read all of the questions, so I'm winging it, and Ledes is going to be mad about that, but I'm sorry ahead of time. So I thought it would be a good conversation and a winging it. So
I'm actually thrilled if the two of you just take over the conversation, because really our goal was just that overlap of the work that is seemingly in different sectors is really quite related. And making those, and I know both of you think about cross-sector often. And so just the two of you talking is fantastic. I'm gonna throw one thing and then feel free to take it. One of the things that I think as a researcher, you're often sort of, there's a tension between the rigor of the data and then when you're working with communities, kind of the unique needs of the community. How do you think about that and how do you balance it? And Natasha, I'll go to you, but if you want to just jump in, either of you, and have a conversation, I think that's great.
Sure. This question is challenging in itself, and it's something that research is grappling with. And I think there are a couple of factors that are at play here. So in general, researchers seek extramural funding and then are funded to do only what is included in that submission. But there's some ways that we can overcome this to support the needs or unique needs of the community and be able to be adaptable. And one is to truly involve the community from the beginning, from identifying the problem to determining the solution to evaluating the intervention. Having the community involved from the very beginning is critical. And this will then allow the community actually to be a co-collaborator in the research funding application process. And then we should also work to write grants that allow for flexibility. So in a recent application that we had, we focused more on the process to work with the community and to determine the health problem and solution in response to community needs, rather than what is generally done, and that is having a pre-described solution. So while we knew that this would make us less competitive for this funding source, we wrote it in a way that would be more responsive to community needs, and we were actually awarded for it. So that in itself was rewarding. But I have to say, there are a few challenges that may contribute to the tension of designing research projects and adapting to community needs from the perspective specifically of academia. And all of this is controversial to share, but the promotion and tenure structures at many universities don't include metrics for community engagement. And why does this matter? It matters because strong community engagement doesn't directly support a professor's potential for advancement. And so we have to acknowledge that that could be an issue, that there is, it's not just that it's not an incentive, it could be de-incentivized at some universities. So that, and I say that because spending time on things that don't directly support the promotion and tenure process can actually work against that same process. I'll share on a positive note, here at University of Louisville, our School of Medicine has added for the Board of Trustees approval promotion and tenure packet that does include community engagement as one of the metrics. So this is very encouraging. I'm sure there are others that are out there doing the same thing, but having that as a part of promotion and tenure allows professors, researchers to have the space to be able to do and grow in this work and not wait until later in their career to engage in this space. But also, depending on the field, some of the funding institutions don't have requirements for community engagement in their grant application announcements as well. So that also further doesn't quite incentivize universities to be fully in support of this. And so with little funding support, and the fact that it could actually work against someone's promotion and tenure process, I think this can give researchers less incentive to engage meaningfully. So I say that to point out how constrained academic researchers can be in both their time allocation as well as funding constraints. And that can make it more difficult to be able to adapt readily to the community's unique needs, but it's of vital importance that we're able to adapt to the community's needs, not just for the success of a project or a relationship, but for the long-term health, safety, well-being, and social capital of the communities where we serve.
You bring up an interesting point around the sort of academic institution, and even though I'm at University of Kansas, I'm not a faculty member, which our center is all soft funded, and we have professional staff, researchers, PhDs, and so forth across disciplines. We are entrepreneurial in how we fund, so we're not. Our careers aren't dependent upon the promotional and tenure process of which you described, which allows us a little bit more freedom in seeking funding from different sources, rather than, one of the things that we have as we've worked in communities across the state and other places is, oh, it's the university coming in and telling us, and some of that is from, faculty members' research agendas that they see data collection as a means to an end. And because they're studying this particular thing or that particular thing. And one of the things that we have as our center, and certainly some others at the university, have really tried to focus more on the community engagement piece and less on kind of what our research agendas are. So the community often drives the agenda, and we're able to kind of do more participatory research, more sense making with the community, more just a little bit innovative, so that we're not having to follow kind of a rigorous research design, but we're often contracted to do innovative systems work that gives us the latitude to do things and explore more so than kind of a research grant, for example, which is great. But what it has done is allowed us to really explore some of the methods of community sense making around data, what things mean, and how to understand data within their own context. One of the things that I've been thinking about lately is kind of what are innovative governance models for cooperative governance around data in communities. Some more of the radical governance side of, community and family owned information, rather than kind of hierarchical structures where the data or the information or the systems are top down. How do we have a more cooperative governance, and how do we drive that? Sometimes it exists outside of traditional governance structures, and that's a different kind of work than some of the things that we do with state agencies who are federal to state to block communities. Really, what is the bottom up approach around governing yourself, communities governing their own resources, having the resources to direct where they need it to go. I mean, where the innovation often is right there at the ground level. And so how can we really think about different models of delegating resources and solutions such that it's not coming from here, and with all of the stipulations and all of the strings attached to it, and potentially all of the other things that are coming with that. How do we flip the script a little bit? So how can we all meet in the middle is I think part of this conversation.
I don't even have to ask any questions. You're both like just leading to the next thing. So thank you. That was fantastic. Will you talk a little bit, and you've already kind of teed this up, both of you, talk a little bit about taking database learnings back to the community and helping them be actionable, either for advocacy or policy capacity, and kind of the research responsibility to do that. We can keep going, Natasha, Teri, if you want, or Teri, if you want to jump in, that's fine too.
So, in terms of helping the data to be able to be kind of more useful, actually, can we switch it to Teri going first this time? Thanks.
Absolutely. Yeah. Well, so I'll give you a concrete example of how we have embedded data back to the communities in part of our implementation process. So as I mentioned, we have a tool named Iris, and we have social care networks across the communities. We intentionally built in a dedicated, facilitated piece of the implementation around reviewing data about the community with the community, so that we're not bringing kind of the data to them and saying, here's what we think it is. Instead, we're sitting down and we're dedicating some time to look at specific pieces. So we might bring the data with, a couple of graphs, or here's what the numbers look like. And part of our job is facilitating, what does that mean? What do you think? And oftentimes it's around, well, here, they're seeing patterns that we would not necessarily see because they're in context. They're like, that looks like, this partner over here hasn't been responding to any referrals or whatever. What's going on there? Is it a workflow issue? Is it that they've something happened? And when you bring the data down to that level, you can identify the specific community-based solutions for that. So we brought some data around being able to share if you could serve, the capacity to serve, and organizations were interpreting that differently across each other. And until you get everybody in the room to say, hey, what does this mean and how are we going to do it? You're going to have those kind of disjointed pieces. And I think from a practical level, being able to provide the data and let the sense making occur in the community is where it's at. This gets our agenda out of the way, and it allows them to see the patterns in context and identify what it means to them and potentially what are the solutions. And let me tell you about one other project that I think is relevant, and I haven't run it, but we do it here at KU. It's called Our Tomorrows, and it's a sense making. SenseMaker it's a tool around narratives, allowing people to share their narratives and to make sense of their own narratives. So it's kind of a qualitative, you could call it qualitative data collection, but it's more than that. So one of the things that we did right before the pandemic was ask a broad question of, tell us about a time when your family was either surviving or thriving. So every county in Kansas, there are 105, had multiple stories coming from families or providers about that experience. And the person writing about their stories, so you've got their narrative of, hey, it was really tough, here's this and that and so forth. Each of those families was able to kind of signify or make sense of their own narrative, rather than the researcher kind of, synthesizing and saying, here are the patterns that we're seeing. They would make sense of it as this was caused by this, or this means that. And so all of those narratives become patterns that you can take back to the community and in terms of the stories that their community are sharing. And from that, the community makes sense of what they're seeing, and then identify solutions, simple solutions, safe to fail solutions around. We keep hearing stories about transportation to, the food bank, that, there's no bus stop or whatever it might be. Well, look, all we need is a bus stop. Not all we need, but, that's a pretty easy solution. So if that is going to solve some of the problems, the community is looking at their narratives and identifying a solution that's simple to solve, let's do it. You know what I mean? So that kind of sense making and community ownership, I think, is so important.
Absolutely. And involving the community in the data and understanding is extremely valuable. So I certainly appreciate what you've shared, Teri. And I'll share briefly about a way that we have used data to shape our work. So we use data actually to inform the implementation, direction, and the design of the Green Heart Project. So in the Green Heart Project, we investigated people's perceptions on trees. So Dr. Lincoln Larson and his team at North Carolina State University, they're collaborators of ours on this project, and they surveyed the population to understand the perception of the community around challenges of greening. And so what we learned was that not everyone wants a free tree. And they examined the reasons why people might have rejected trees in the study. And while the community members noted the benefits in terms of beautification, improved air quality, and shade that trees provide, they also noted a number of challenges in implementing this intervention that were some barriers that we needed to identify where fell in with our responsibility of overcoming these to ensure implementation of this study. So they cited the threat of gentrification and raising property values and displacement that could result as a challenge. Some said that they weren't interested in trees because of the maintenance issues with trees, like raking leaves, as well as the cost of upkeep. They also noted the burden that the tree roots may have, that it could cause damage to the sidewalk or to the plumbing or to the driveway. They also noted some safety risk where trees could actually give a place for people that intend to do harm to hide, gives them actually a place of cover. So they noted a safety concern with trees as well. And then also that trees could hinder mobility. So if someone has a yard that's currently easy in terms of accessibility, adding a tree might change that landscape and it may not be as accessible. So those were some of the concerns that people raised. And so we worked to examine, look at these barriers and then also see what we could do to address some of the concerns. So one thing that we did was in terms of the tree selection, we selected trees that don't add to the leaf raking issue. We selected trees that are evergreen for residential planting. And then this cuts down on the additional burden of raking leaves in the fall. And then also from the maintenance perspective that was raised, we established the Green Heart Tree Assistance Fund. So members of the community can apply for funds to support tree maintenance, or pruning, removal, or replacement. And we have members that serve on this Tree Assistance Fund committee that include the local government. We have a local council person that's on, and one of the researchers from the Green Heart Project. And then we also have strategic partnership, and that allows for tree planting education, where we as researchers may not, or the research team might not be the best people to educate on the tree planting aspects. We have partnered with other organizations that are able to shore up and disseminate that type of information. So that's a little bit of how we've used data to inform and transform this research project.
I want to come work with you.
I want to work with you as well.
That's amazing. I really love that. I mean, that is the power of folks being able to surface things that you might not have thought about. I mean, I would love a tree, but I also, recognize that, oh, you're right. It can uproot your sidewalks, and then you've got to pay for that. And, it comes down to how do we address those? And I love that fund that allows folks to, have a tree and, not worry about having to pay for it.
Absolutely.
Yeah.
Thank you.
Do it. Let's do it.
Yes.
I just have to say, I've watched each of you lean into the screen at different places, and I feel like that's really all I was looking for. Listening to both of you, what comes to mind for me, and now I'm going off script, I apologize, is this idea of research being very cross-sector. So even the idea of putting a fund together and having community champions or an advisory board and having to think about more than just, Natasha, you're doing a randomized controlled trial. I think there are a lot of us that hear that and think you bring people in, you do something with them, they're gone. It's pretty easy. There probably some of my friends would not be happy with me saying that's easy, but definitely not as involved in the community as you're describing. And then Teri, knowing what I know about IRIS, it's a full community cross-sector network. And then you're also using social network analysis to understand the strength of the network and kind of how it morphs over time. These are much more involved and centered in the community than I think often people think about research, which is obviously why we are excited to put the two of you in conversation. So I just have like real simple questions now. Are there other things that I have missed or that one is brought up for the other that you want to stop and kind of camp on for a second? There's no pressure.
I was thinking about kind of environmental health and justice and those efforts around social determinants of health and that intersection, because I think, do you have a background in public health?
I do, yes.
Okay. I do not. So thinking about the fact that the majority of the variants for social determinants of health are outside of the medical profession, and that holistic approach. I mean, once you see that, you can't go back from it. And I think that probably is a thread that allows us to kind of get out of the silo, one particular silo around health and well-being. And I think of those things kind of together, health and well-being. And I also think about, I'm going to say it, but there's no one from the federal government or state agencies that are going to save us. And I listened to, I think it was a NPR report around, perhaps it was flood. I don't remember what the issue was, but at the source of a community emergency, it's neighbors, it's the people that are there that tend to have the best ideas for solving the problems, and waiting for these big systems to at the federal level or at the state level to come together and really address what is happening on the ground, I think is for me, it was kind of a bigger shift than I had thought, because for whatever reason. So if communities are really at the source of the solutions, that's where our focus has to be. And we can't, it's sort of like big ships trying to move this ship or that ship at this broader level, when we've got some speedier, more flexible and adaptive, whatever the analogy is at the community level, that can mobilize much more quickly, can identify better solutions, and can make things happen faster than waiting for big systems to suddenly de-silo. So I'm not sure where I was going with that, but that's what I was thinking.
No, I think that's of great importance. We have communities that can say, not in my backyard, and it doesn't happen in their backyard. And then we have other communities that can say, not in my backyard, and it's as if their voices are not heard or valued. And I think about my family, as I shared before. My parents raised their families in an area of environmental injustice. And so when I think about studies, data, I don't just see numbers. I see my family there. I see a community that has not been, their voice hasn't been valued in the decision-making process, or that that they haven't been consulted in the decision-making process at all. And so I take that community in Alabama where my grandparents live and can insert that very well into the community that we serve right here in Louisville, Kentucky, which is an area of environmental justice. Our west end of Louisville has a 12-year shorter life expectancy compared to eastern Louisville. And so, and I see and experience those trends, and my family has experienced those trends. So thinking about communities and thinking about data and communities' involvement and engagement around that, I think about giving voice to the voiceless through also seeing this data, interpreting data, and interpreting it right alongside communities as a part of that process. And so I think about viewing data as people, not just as data. And I think that's a challenge in the area of the sciences. Because if you think about a research structure, once a person enters a research study, their data is attached to a number that's used to de-identify them, and that's for security purposes, so that has a great benefit. But it can in turn make researchers see them as a number and not a person. It's beneficial because it can take away some bias. You're not necessarily looking at Mary's data and interpreting this exactly through Mary's eyes, which can have some bias with it. But it is riddled with challenges because you're kind of detaching the humanity aspect from the data and the answers that we're trying to uncover. So I think a solution to that is engaging more with the community around the data. And Teri has a wonderful example of doing this. I mentioned our Superfund Research Center's Community Engagement Core. And so in this Community Engagement Core, we work to facilitate this bidirectional transfer of knowledge. So our plan is to give space for community members to engage around this data. So we host these community advisory board meetings and these community knowledge exchange sessions with the intent that the researchers may present findings to the community and that the community has the opportunity to respond. Or maybe not just findings, but the researchers might present ideas or the direction or the actions that are being planned. So for example, last fall in a community advisory board meeting, one of our researchers presented the status of how they plan to operationalize some of the air monitoring. We're monitoring volatile organic compounds. So how they plan to operationalize that, and the community was able to weigh in with their feedback, their reaction, and any additional requests that might have been beyond what was already on the researchers' radar. So I think that a solution when it comes to data and communities is to ensure that the community is a part of not only providing the data, but also interpreting and contributing meaningfully in the conversations that are around the data.
Absolutely. Megan, I have a couple of thoughts from that. Certainly as researchers, we must be rigorous and ensure confidentiality, all of those things. And we, have a guise of objective third party, right? However, we're also humans, and I am not afraid to say that I advocate for certain things. I want communities to have the resources that they need. So therefore, the research and the data that I focus on is making that case. Do I have support to say that these are the resources that this community has said that they need? Here's the data that show that. I mean, I obviously don't make up data, but from an kind of an agenda standpoint, it's around advocacy around health and well-being. And how do we advocate with data in a way that is, of course, responsible, but also doesn't get bogged down in like the statistical, a geeky, analysis. We can do that. Our job is to translate that into meaningful meaning with communities and to make the kinds of cases that we need to make in order to say, this is what we're hearing, what's available, what do we need? So advocacy for sure. The other thing that I was thinking about when you talked about data as people, I was able to lead a study that looked at early childhood services as prevention of removals into foster care, and that particular area is near and dear to my heart. And when I think about the foster care system, and when I think about how do we prevent children from being abused and neglected, and what are effective prevention strategies? These were big data sets, right? There are 30,000 kids who got early childhood services, and in this particular state, this many children were removed into foster care at a certain time. We link those together to see how, whether or not early childhood services prevented removals. And short story is, it does. It's statistically significant as a preventative service. And when I started looking at the numbers, I mean, we're talking about, when we get down to it, couple of hundred kids here and there, right? That because they were received early childhood services, they were prevented. So when I think about a couple of hundred kids, I think about each individual child, rather than making the case about big numbers. The lifetime impact of early childhood trauma and abuse is too much to bear. So when I think about 140, I think about each individual child, and that is why we do the work. Is there are people, children, adults, family members attached to each of those numbers, and we've got to keep that in mind as we're translating and doing the work, because if we're not doing that work, who is? And it's part of responsibility and calling is to be able to tell those kinds of stories with data, while also keeping in mind, if we know something that is going to save or prevent X, Y, or Z, whether it's environmental injustice or child abuse and neglect, we have to do our part to elevate that and amplify that. So that's my feeling about that. It's a responsibility and a calling and an obligation, frankly, as researchers.
So you each have taken all of my questions and they're perfect. And I was going to end on, because you've touched on my remaining questions, but I want to end on, are there pieces, seemingly, and I'm speaking for my public health colleagues, they would probably, often we think about putting you each into kind of different buckets of work. When you actually get into the conversation, you're doing a lot of very similar things and thinking about things in a really similar way. Are there things that the other has said that you think you could incorporate into your work, or you want to kind of think about more fully? Did this conversation spark any more cross-sector light bulbs for you? Is kind of my last thought.
Oh, absolutely. So many cross-sectoral light bulbs. One thing that I hear ringing through are the needs for partnerships with different expertise. And that's something that we are doing. And I think that's something that we can always all continue to grow in the space of. So I think that partnerships are absolutely critical because none of us can always be within the communities that we serve day to day or at all times. But having meaningful partnerships, and none of us can be the all in all to the different needs of our community. We've talked about, constraints in terms of time and availability, as well as financial resources. But having strategic partnerships can allow for different gaps to be filled through different areas of expertise. So in the Green Heart Project, we have our scientific and health team that bring that area of expertise, but we also work with a group that has a trained team of citizens foresters that actually help to educate the community about the importance of urban tree canopy and tree planting. We've been able to work successfully with local neighborhood associations that have helped to further disseminate the word and make viable connections between us, between the community. We work with local schools, faith-based organizations, those that fill the gap and have further wider engagement and dissemination, even the local library and the local conversation club around potential translation. So each of, and there are challenges in bringing lots of groups to the table to have, you know, great collaboration, because we all have our different areas of expertise. We all have our different vantage points, but there's so much strength in being able to bring a lot of partners around that have a shared goal. So this means that we don't have to be the sole person that's responsible for the day-to-day activities in the community, that we all have a role. And data collection is benefited by all of us, internal and external collaborators, and all of these different unique partners having a role in the full execution of the project. So I think partnership is something that has stood out to me through this discussion. The social networks as a social fabric, that's something I'm definitely going to be marinating on, and would love to learn more and understand how that can deepen more meaningful community engagement, as we have this project that very intricately works with the community, and empowering people in the space of data, involving people in data collection. I haven't shared with you all about our environmental eco study. This is always an acronym, environmental exposures and chronic health outcomes study. So we're looking at chronic health outcomes, namely cardiovascular disease and its relationship to air pollution exposures. But within this study, we're actually giving the patients their data. And it has always been my experience in research. I won't say this is research across the board, but in academic research that we say, you know, this data is experimental, so we're not able to share this data back with the community, but we're collecting all this health information that we're deeming to be important and that we are hope to be able to publish off of and advance the science. But what's also of vital importance is that the people that have contributed to this receive that information back. So we have been IRB approved to actually share their study data back with them. And we're really proud of this step to be able to do that. And I think that, you know, that in addition to having the community at the table to analyze and understand data, I think this also empowers people personally over their health as well. And so that's some of what I'm taking from this conversation, but I think there's so much that aligns with Teri's work, with my work, opportunities to learn and grow and collaborate far and wide.
Yes, a couple of things as you were talking. One around, first of all, I appreciate, you know, from an academic perspective, you being able to push the IRBs and the funders to be able to understand that it's an individual's data. They have a right to it. They have rightful ownership of that data, and it should be shared. So I'm a big advocate for if it's your data, it is your data, and you consented, and it is yours. So we responsibly steward data for others, and that means giving back. I hope the NSFs and the other, you know, those folks start to learn around that, because it's not precious for them. It is a precious information for an individual to make sense of. That was one. What I really liked about what you were talking is how you identified emergent patterns and how you brought in different perspectives to come up with solutions. So, I mean, I imagine you didn't come into the study thinking, oh, people aren't going to want trees, right? So being able and open to hearing what's emerging from the work and coming up with community-driven solutions. I mean, that is the perfect kind of study in my mind, because it's advocacy, it's research, it's community engagement, and it's, you know, it's all of the good things. And University of Louisville is lucky to have you, one. And number two, I do hope our paths cross. I'm from Indiana, so I also have a friend who's at Louisville in the School of Social Welfare. So next time I'm in town, I'm going to give you a call, and we're going to get together and talk social networks and emergent patterns.
Yes, I would love that. Absolutely.
Yeah.
I also love what you shared earlier about what it means to have a healthy community. I think that we don't take time to examine around that as much as we should. And that's something that we've been talking internally in our team. Like, what is the exact definition of health? We know what the absence of good health is, but what is this true definition that we're trying to rally around preserving? So I love what you raised in the conversation around that too.
Well, let's figure that out and put some ideas forth, because we have to have alternatives for people to hold on to and to strive towards, and to be able to say, this is what we need and deserve and want. So
Absolutely.
And with that, I feel like Public Health Plus's work is done. Thank you very much. I love it when two big minds meld like that and start kind of riffing off each other. That was my whole goal for this conversation, and I think you've exceeded my expectations, as I should have known you both would. So thank you.
of course,
Thank you.
it's been a pleasure, Natasha. I want to keep in touch for sure on your projects. They are amazing. Thank you for doing that work. I know it means a lot to people, and it means a lot to me that your heart is in that. And if I need to call up, the university and say, give her some points for community engaged scholarship, I'll write that letter for you. So,
Thank you. That is much appreciated. And certainly Iris is an example and a model for us all. So thank you for your work as well. And I look forward to us staying connected around these important topics.
Awesome.
Thank you both.
Thanks, Megan.
Thank you.
Take care.